and today we are going to discuss about a very important molecule which has been in use in different specialties of medicine for last so many decades. The name of the molecule is aspirin. Aspirin is the common name used for a chemical substance called acetylsalicylic acid. Now, what is aspirin and in which conditions is it taken? Aspirin is used in various conditions to relieve pain and swelling, for example, in headache, toothache, body ache, joint pains, etc., or to bring down the body temperature, high body temperature, to prevent the recurrence of heart attacks or strokes. That is, if someone has previously had a heart attack or stroke, if he takes aspirin regularly, then it reduces the risk of a blood clot occurring in the arteries of the heart or brain. This can prevent further heart attacks or strokes. It is also used in various other clinical situations in coronary artery disease, such as acute myocardial infarction, which is commonly known as heart attack. It is also used in secondary prevention of heart attacks, then prevention of the cardiovascular morbidity in patients suffering from stable angina pectoris. Then there is history of angina pectoris, of course, except in the acute phase. Prevention of the graft occlusion in coronary artery bypass graft, in coronary angioplasty, except during acute. There are so many conditions where aspirin can be used. The question comes that how does aspirin act? Aspirin acts, which I told you in the earlier condition which I had mentioned, it acts in the first two conditions. It acts on the pain and temperature controlling center of the brain. In the third and fourth conditions, which I mentioned, it acts on platelets. Platelets are certain cells which play an important role in blood clotting. Aspirin influences the blood's clotting action by reducing the clotting action of platelets, and thus decreases the possibility of heart attack or stroke. But it is not mentioned, or it is not recommended for their primary prevention. Why and what should you check before taking aspirin? Please do not take aspirin if you are allergic to aspirin, or rarely, of course, which is very theoretical. If you are allergic to any of the ingredients used in the formulation of aspirin tablets, or if you have had any problem in clotting of blood, or if you have had an ulcer in your stomach or small intestine. Now, before you take aspirin, tell your doctor if you think that you're dehydrated. That is, you may feel thirsty with a dry mouth. These are signs of dehydration. Or if you have any trouble with your kidneys or with your liver, if you have high blood pressure, or if you are asthmatic. If any of these apply to you, then if you are not sure, then please speak to your doctor before taking aspirin. Now, so far as taking other medicines are concerned, there are so many other medicines where the effect of the treatment may be influenced if aspirin is taken along with them. For example, certain high blood pressure medications like diuretics, ACE inhibitors, pain and inflammation medicines like ibuprofen, or for gout, people take certain medication, hormone replacement therapy, epilepsy, certain infections, glaucoma, eye disorder. Then thinning of blood or prevention of clots, then during kidney transplant, liver transplant, etc., or cancer or rheumatoid arthritis. These various diseases are there. Now, if you're having these problems, if you're taking drugs meant for those diseases, please discuss taking aspirin with your doctor. What is more important, since many of you are belonging to the senior citizen category, what precautions should be taken by the senior citizens or by older people? In general, aspirin should be used with caution in elderly patients who are more prone to adverse effects, that is side effects. The usual adult dose is recommended in the absence of any severe liver or kidney problem. But treatment should always be reviewed by the doctor in consultation with the patient at regular intervals. In what form of medications is aspirin available? across the Chemist board. For oral use, aspirin is available in 3 forms in various strengths from 75 milligram to 300 milligram. As a plain formulation, aspirin is used in headache, toothache, migraine, neuralgia, sore throat, dysmenorrhea, that is period pain, influenza, feverishness, rheumatic pains, etc. Now, as a soluble form, in addition to what I discussed about the plain tablet uses, soluble aspirin tablet is generally used for acute conditions such as heart attacks, unstable angina, which is again a condition which predisposes to heart attack, and cerebral transient ischemic attacks, so mini strokes, what you call. And the third form of aspirin is enteric coated, or it is also called as gastro resistant. So why it is called as gastro resistant? It is because it is coated with a special coating so as to reduce or so as to resist the action of gastric juice in stomach. Now this formulation then gets directly released in the intestine, not in the stomach. It is used for long-term management of secondary prophylaxis of heart attacks and in patients with unstable angina and in cerebral transient ischemic attacks, which I said earlier. Abroad, it is also available as orodispersible tablets, means they are mouth dissolving tablets. You just keep it in the mouth, they get dissolved. Aspirin is also available as rectal suppositories, what sometimes people use, bisacodyl in constipation. The same way, aspirin is also available as rectal suppositories. A question comes, very important, is how to take aspirin. Always take aspirin exactly as your doctor has told you. You should check your doctor if you're not sure. Remember that the treating doctor decides the dose and frequency of taking aspirin, depending on various factors. The doses and frequency of oral aspirin commonly prescribed by doctors is now what I'll tell you. In pain and swelling or in fever, it is taken as about 3 tablets, up to 3 tablets of 300 milligrams, 3 to 4 times a day. That is about 1 to 4 grams per day. In acute rheumatic disorders, that is joint and muscle problems, your doctor, of course, will tell you how many tablets are to be taken, how often, etc. So generally, the patient requires about, in these conditions, 4 to 8 grams of aspirin a day. In secondary prevention of heart attacks, angina, or mini strokes, the usual dose is 1 or 2 tablets of 75 milligrams each day. Sometimes the doctor may also tell you to take 1 tablet of 300 milligrams once a day. Aspirin should be taken generally with or straight after a meal or some snack. This will, of course, help to reduce the risk of any stomach irritation. And if you have been given any soluble, that is dispersible tablet, then each of the tablet or each of the dose has to be taken, the tablet has to be stirred, dissolved in a glass of water, stirred, and then that solution has to be taken. Third thing is the gastro-resistant tablets, which I told you, also called as enteric coated or EC tablet. Now, these can be taken before food because they have a special coating, which helps to prevent irritating them from the stomach. Now, these tablets should not be cut, should not be crushed, should not be chewed, as this will damage that special coating. If the coating is damaged, the tablets are likely to irritate your stomach. If you may be taking this medicine for a long time, then obviously you have to consult your doctor frequently. I also mentioned about the orodispersible or the mouth dissolving tablets. Now, these should be placed on the tongue and allowed to dissolve. Take care not to handle the tablets too much before placing it on the tongue. Otherwise, the moisture will damage the tablets.